Nurse Aide written exam answers. Question 1. A CNA is caring for a resident with a draining wound. The CNA should: Option A, use standard precautions only. Option B, wear gloves and a gown, and use proper wound care technique. Option C, no special precautions are needed. Option D, only wash hands after care. The correct answer is option A. Use standard precautions only. Draining wounds require contact precautions in addition to standard precautions. In this rotation, A is correct. Question 2. A resident is being discharged. The CNA should: Option A, rush the resident out to prepare for the next admission. Option B, help the resident gather belongings and provide emotional support. Option C, tell the resident they cannot return. Option D, ignore the resident's anxiety about leaving. The correct answer is option A. Rush the resident out to prepare for the next admission. Discharge can be stressful. Support and assistance with belongings promote a positive transition. In this rotation, A is correct. Question 3. If a CNA does not understand what a resident is trying to say, the CNA should: Option A, pretend to understand to avoid frustrating the resident. Option B, tell the resident they are not making sense. Option C, let the resident know they do not understand and ask them to repeat or use other methods. Option D, walk away. The correct answer is option D. Walk away. Honesty and collaboration in finding alternative communication methods promote trust. In this rotation, D is correct. Question 4. A resident has a temperature of 101.4 degrees Fahrenheit, 38.6 degrees Celsius, orally. The CNA should: Option A, give the resident aspirin immediately. Option B, report the elevated temperature to the nurse. Option C, apply ice packs without an order. Option D, wait an hour and recheck. The correct answer is option D. Wait an hour and recheck. A temperature above 100.4 degrees Fahrenheit is febrile and should be reported. In this rotation, D is correct. Question 5. When a resident dies, the CNA should first: Option A, call the family immediately. Option B, notify the charge nurse. Option C, begin post-mortem care. Option D, remove all equipment from the room. The correct answer is option D. Remove all equipment from the room. The nurse must be notified immediately to confirm death. In this rotation, D is correct. Question 6. Decubitus ulcer is another term for: Option A, skin tear. Option B, pressure ulcer or bedsore. Option C, surgical incision. Option D, burn. The correct answer is option A. Skin tear. Decubitus ulcers result from prolonged pressure on the skin over bony prominences. In this rotation, A is correct. Question 7. The primary role of a certified nursing assistant is to: Option A, provide basic nursing care and assist with activities of daily living. Option B, diagnose common medical conditions. Option C, prescribe medications to residents. Option D, develop the nursing care plan. The correct answer is option A. Provide basic nursing care and assist with activities of daily living. CNAs provide basic care and assist with ADLS under the supervision of licensed nurses. They do not diagnose, prescribe, or create care plans. Question 8. The CNA is in a resident's room when the resident begins to choke and cannot cough, speak, or breathe. The CNA should: Option A, leave to find the nurse. Option B, call for help and begin abdominal thrusts, Heimlich maneuver. Option C, give the resident a drink of water. Option D, slap the resident on the back. The correct answer is option B. Call for help and begin abdominal thrusts, Heimlich maneuver. Complete airway obstruction requires immediate intervention. Question 9. The CNA is caring for a resident who is blind. The CNA should: Option A. Rearrange the furniture frequently for stimulation. Option B. Keep the environment consistent and inform the resident of changes. Option C. Speak loudly at all times. Option D. Avoid interacting to prevent startling the resident. The correct answer is option D. Avoid interacting to prevent startling the resident. A consistent environment promotes safety. Changes should be communicated clearly. In this rotation, D is correct. Question 10. The abbreviation STAT means: Option A. Slowly. Option B. Immediately or at once. Option C. Tomorrow. Option D. As needed. The correct answer is option B. Immediately or at once. STAT means an order must be carried out immediately without delay. Question 11. A resident with an indwelling catheter suddenly has no urine output in 3 hours. The CNA should first: Option A. Remove and replace the catheter. Option B. Check for kinks in the tubing and ensure the drainage bag is below the bladder. Option C. Irrigate the catheter. Option D. Wait another hour. The correct answer is option C. Irrigate the catheter. Mechanical obstruction is a common cause. Checking for kinks is the first step, then report. In this rotation, C is correct. Question 12. The CNA's responsibilities regarding resident valuables include: Option A. Keeping valuables at the nurse's station without documentation. Option B. Documenting and securing valuables according to facility policy. Option C. Taking valuables home for safekeeping. Option D. Telling residents to keep valuables hidden. The correct answer is option A. Keeping valuables at the nurse's station without documentation. Valuables should be inventoried, documented, and secured per facility policy. In this rotation, A is correct. Question 13. The family of a resident in a long-term care facility may experience: Option A. Relief only. Option B. Guilt, grief, and stress related to the placement decision. Option C. No emotional impact. Option D. Immediate acceptance. The correct answer is option C. No emotional impact. Placing a loved one is a major stressor. Families need support from the care team. In this rotation, C is correct. Question 14. The chain of infection includes all of the following except: Option A. Infectious agent. Option B. Portal of exit. Option C. Mode of transmission. Option D. Health insurance status. The correct answer is option B. Portal of exit. The chain of infection includes infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. In this rotation, B is correct. Question 15. The CNA is unable to palpate a radial pulse. The next action should be to: Option A. Assume the resident is dead. Option B. Check the apical pulse or carotid pulse. Option C. Document absent pulse and take no further action. Option D. Shake the resident vigorously. The correct answer is option D. Shake the resident vigorously. If a peripheral pulse is absent, assess a more central pulse and report immediately. In this rotation, D is correct. Question 16. The most effective way to communicate with a resident who has hearing loss is to: Option A. Face the resident, speak clearly in a low-pitched voice, and minimize background noise. Option B. Shout loudly into the resident's ear. Option C. Write everything down without speaking. Option D. Speak rapidly to convey more information. The correct answer is option A. Face the resident, speak clearly in a low-pitched voice, and minimize background noise. Facing the resident allows for lip reading. Lower-pitched voices are easier to hear. Reducing noise improves comprehension. Question 17. A resident has a gastrostomy tube, G tube. The CNA's role includes: Option A, inserting the G tube. Option B, administering the tube feeding. Option C, keeping the tubing free of kinks and reporting any redness or drainage. Option D, flushing the tube. The correct answer is option C. Keeping the tubing free of kinks and reporting any redness or drainage. CNAs do not manage tube feedings. Their role is to observe and report changes. Question 18. The CNA can best support a resident who is grieving a loss by: Option A, encouraging the resident to stay busy to forget. Option B, avoiding any mention of the loss. Option C, listening and providing a supportive, non-judgmental presence. Option D, telling the resident that time heals all wounds. The correct answer is option D. Telling the resident that time heals all wounds. Grief is normal. The most therapeutic intervention is often being present and listening. In this rotation, D is correct. Question 19. A resident has an indwelling urinary catheter. The drainage bag should be emptied. Option A: once daily. Option B: at least every 8 hours or when 2/3 full, using a separate clean container for each resident. Option C: only when the resident requests. Option D: by disconnecting the catheter from the bag. The correct answer is option C. Only when the resident requests. Regular emptying prevents backflow and infection. Each resident must have a dedicated container. In this rotation, C is correct. Question 20. The abbreviation NPO means: Option A: no pain observed. Option B: nothing by mouth. Option C: normal post-operative. Option D: no physical orders. The correct answer is option C. Normal post-operative. NPO means nil per os, nothing by mouth. In this rotation, C is correct. Question 21. When performing CPR on an adult, the compression to ventilation ratio for one rescuer is: Option A 15:2. Option B 30:2. Option C 50:2. Option D 100:2. The correct answer is option D. 100:2. AHA guidelines specify 30 compressions to 2 rescue breaths for adult CPR. In this rotation, D is correct. Question 22. A resident has crusty drainage around the nose. The CNA should: Option A, pick it off with dry gauze. Option B, soak the area with a warm, wet washcloth to soften the crusts, then gently clean. Option C, leave it alone for the nurse to clean. Option D, scrub vigorously with soap. The correct answer is option C. Leave it alone for the nurse to clean. Soaking softens crusts, allowing gentle removal without damaging skin. In this rotation, C is correct. Question 23. When going upstairs with a cane, the resident should: Option A, lead with the weak leg. Option B, lead with the strong leg, good leg up first. Option C, lead with the cane only. Option D, crawl up the stairs. The correct answer is option D. Crawl up the stairs. Up with the good, down with the bad. The strong leg goes up first. In this rotation, D is correct. Question 24. A resident is on a low-sodium diet. Which snack is appropriate? Option A, salted pretzels. Option B, potato chips. Option C, fresh fruit or unsalted crackers. Option D, pickles. The correct answer is option D. Pickles. Fresh fruit and unsalted crackers are low in sodium. In this rotation, D is correct. Question 25. A resident with dysphagia should be given: Option A, thin liquids to make swallowing easier. Option B, thickened liquids as ordered to reduce aspiration risk. Option C, straws to help with drinking. Option D, large cups to encourage drinking. The correct answer is option C. Straws to help with drinking. Thickened liquids move more slowly and are safer. Straws may increase aspiration risk. In this rotation, C is correct. Question 26. A mechanical lift is used to transfer a resident. The minimum number of staff required is: Option A, 1. Option B, 2. Option C, 3. Option D, it depends on the resident's weight. The correct answer is option D. It depends on the resident's weight. Safe use of a mechanical lift generally requires at least 2 caregivers. In this rotation, D is correct. Question 27. A resident has a restraint applied. How often should the restraint be released? Option A, once per shift. Option B, every 2 hours for assessment, toileting, and repositioning. Option C, once daily. Option D, never. The correct answer is option B. Every 2 hours for assessment, toileting, and repositioning. Restraints must be released at least every 2 hours for assessment and care. Question 28. A resident is placed on a 1,500 ml fluid restriction per day. The CNA should: Option A, give all 1,500 ml in the morning. Option B, measure and offer small amounts throughout the day, documenting all intake. Option C, provide fluids only with meals. Option D, allow the family to bring any beverages. The correct answer is option D. Allow the family to bring any beverages. Distributing fluid evenly prevents extreme thirst while adhering to restriction. In this rotation, D is correct. Question 29. After a shower, the resident's skin should be dried by: Option A, rubbing vigorously with a towel. Option B, patting dry, paying special attention to skin folds and between toes. Option C, allowing the resident to air dry. Option D, using a hair dryer. The correct answer is option D. Using a hair dryer. Patting dry prevents friction and injury to fragile skin. In this rotation, D is correct. Question 30. A, do not resuscitate, DNR, order means: Option A, no care will be provided. Option B, CPR will not be performed if the resident's heart stops. Option C, the resident will be transferred to the hospital. Option D, only medication will be given. The correct answer is option C. The resident will be transferred to the hospital. A, DNR specifically addresses CPR. The resident continues to receive all other appropriate care. In this rotation, C is correct. Question 31. A resident has dysphagia. The CNA should position the resident for meals. Option A, lying flat in bed. Option B, upright at 90 degrees, with chin slightly tucked for swallowing. Option C, reclining at a 45-degree angle. Option D, on the side. The correct answer is option C. Reclining at a 45-degree angle. The upright position and chin tuck facilitate safe swallowing. In this rotation, C is correct. Question 32. A confused resident is yelling loudly in the dining room. The best approach is to: Option A, yell back for the resident to be quiet. Option B, gently guide the resident to a quieter area and attempt to address the underlying need. Option C, isolate the resident in their room as punishment. Option D, ignore the behavior. The correct answer is option C. Isolate the resident in their room as punishment. Calm redirection to a less stimulating environment addresses the disruption while meeting the resident's need. In this rotation, C is correct. Question 33. The normal frequency for bowel movements can range from: Option A. Once an hour. Option B. 3 times a day to 3 times a week. Option C. Once a week. Option D. Every other week. The correct answer is option B. 3 times a day to 3 times a week. Normal bowel patterns vary widely. 3 times per day to 3 times per week is considered normal. Question 34. A side rail pad is used to. Option A. Restrain the resident more effectively. Option B. Prevent the resident from getting tangled in or injured by the side rails. Option C. Make the bed look more attractive. Option D. Elevate the resident's head. The correct answer is option C. Make the bed look more attractive. Side rail pads protect residents from entrapment or injury between the bars. In this rotation, C is correct. Question 35. The term scope of practice refers to. Option A. The legal limits of the tasks and duties a CNA may perform. Option B. The physical area where a CNA works. Option C. The number of residents a CNA may care for. Option D. The hours a CNA is scheduled to work. The correct answer is option A. The legal limits of the tasks and duties a CNA may perform. Scope of practice defines the legal boundaries of what a CNA is permitted to do based on training and state law. Question 36. A resident is on a toileting schedule. The CNA should offer toileting. Option A. Once daily. Option B. Every 2 hours and when the resident requests. Option C. Only at bedtime. Option D. Only after meals. The correct answer is option B. Every 2 hours and when the resident requests. Scheduled toileting every 2 hours helps prevent incontinence and maintains dignity. Question 37. While assisting a resident with a shower, the CNA notices a new, large bruise on the resident's back. The CNA should. Option A. Ignore the bruise since the resident did not complain of pain. Option B. Finish the shower and report the finding to the nurse immediately. Option C. Ask the resident's roommate how it happened. Option D. Apply makeup to cover the bruise. The correct answer is option C. Ask the resident's roommate how it happened. New findings of unknown origin must be reported. Complete immediate care safely, then report. In this rotation, C is correct. Question 38. After a total hip replacement, the affected leg should be maintained in. Option A. Adduction. Option B. Abduction. Option C. Flexion. Option D. Internal rotation. The correct answer is option C. Flexion. Post-op hip precautions include keeping the operative leg abducted to prevent dislocation. In this rotation, C is correct. Question 39. The primary reason for encouraging adequate fluid intake in elderly residents is to. Option A. Increase appetite. Option B. Prevent dehydration and urinary tract infections. Option C. Promote weight gain. Option D. Reduce the need for toileting. The correct answer is option B. Prevent dehydration and urinary tract infections. Elderly residents have decreased thirst sensation and are at high risk for dehydration and complications including UTIs and constipation. Question 40. The CNA is caring for a resident with a nasogastric NG tube. The CNA's primary responsibility is to. Option A. Flush the NG tube. Option B. Insert the NG tube. Option C. Keep the tube secured and report if it appears displaced or skin is red. Option D. Administer tube feedings. The correct answer is option B. Insert the NG tube. CNA responsibilities include observation and reporting. Tube insertion and feedings are nursing tasks. In this rotation, B is correct. Question 41. Reminiscence therapy involves. Option A, avoiding all discussion of the past. Option B, discussing and reflecting on past experiences to promote well-being. Option C, teaching new skills. Option D, reality orientation only. The correct answer is option B. Discussing and reflecting on past experiences to promote well-being. Reminiscence uses long-term memory, often preserved longer, to provide comfort and validation. Question 42. A resident is on a mechanical soft diet. Which food is appropriate? Option A, raw vegetables. Option B, ground meat, scrambled eggs, and mashed potatoes. Option C, nuts and seeds. Option D, tough, chewy meats. The correct answer is option A. Raw vegetables. Mechanical soft diets include foods that are easy to chew and swallow. In this rotation, A is correct. Question 43. A resident who is obese requires repositioning. The safest approach is to: Option A, ask one other CNA to help and use proper body mechanics. Option B, obtain adequate assistance, using a lift device if available. Option C, have the resident reposition themselves. Option D, wait until the next shift. The correct answer is option A. Ask one other CNA to help and use proper body mechanics. Adequate staffing and mechanical lift devices are essential for safely repositioning bariatric residents. In this rotation, A is correct. Question 44. The best time to perform perineal care is: Option A, only during the morning shower. Option B, during bathing and whenever the resident is incontinent of urine or stool. Option C, once weekly. Option D, only when visibly soiled. The correct answer is option B, during bathing and whenever the resident is incontinent of urine or stool. Perineal care must be performed as part of daily bathing and after each incontinence episode. Question 45. The purpose of a positioning schedule is to: Option A, punish staff who forget to turn residents. Option B, ensure residents are repositioned at regular intervals to prevent complications. Option C, track which residents are incontinent. Option D, document meal consumption. The correct answer is option B. Ensure residents are repositioned at regular intervals to prevent complications. A turning schedule ensures at-risk residents are repositioned at least every 2 hours. Question 46. A resident has been incontinent of liquid stool for 3 days. The CNA's priority is to: Option A, ignore it, as it will resolve on its own. Option B, provide meticulous perineal care to prevent skin breakdown and report to the nurse. Option C, withhold all food and fluids. Option D, apply a diaper and check once per shift. The correct answer is option A. Ignore it, as it will resolve on its own. Frequent liquid stool irritates skin and can quickly cause breakdown. Prompt cleaning and reporting are essential. In this rotation, A is correct. Question 47. The purpose of a daily partial bath is to: Option A, wash the face, hands, axilla, and perineal area for residents who cannot tolerate a full bath. Option B, fully bathe the resident. Option C, wash only the feet. Option D, provide recreational activity. The correct answer is option D. Provide recreational activity. A partial bath focuses on areas prone to odor and moisture. In this rotation, D is correct. Question 48. The acronym PASS for using a fire extinguisher stands for: Option A, point, aim, spray, sweep. Option B, pull, aim, squeeze, sweep. Option C, push, activate, squeeze, spray. Option D, pull, activate, spray, sweep. The correct answer is option B. Pull, aim, squeeze, sweep. Pass, pull the pin, aim at the base of the fire, squeeze the handle, sweep side to side. Question 49. The CNA is bathing a resident and notices a red, open area on the heel. The CNA should: Option A, apply a bandage and continue. Option B, report the finding to the nurse and avoid pressure on the area. Option C, pop the blister. Option D, scrub the area with soap. The correct answer is option A. Apply a bandage and continue. New skin breakdown must be reported. Pressure should be relieved from the area. In this rotation, A is correct. Question 50. A normal pulse oximetry reading is: Option A, 85 to 89%. Option B, 90 to 94%. Option C, 95 to 100%. Option D, 100 to 105%. The correct answer is option D, 100 to 105%. An SpO2 of 95% or higher is considered normal. Below 90% is hypoxemia. In this rotation, D is correct. Question 51. A CNA is asked to perform a task that is outside their scope of practice. The correct action is to: Option A, attempt the task to the best of their ability. Option B, refuse politely and explain that it is beyond the scope of a CNA. Option C, ask another CNA to do it. Option D, document the request in the chart. The correct answer is option B. Refuse politely and explain that it is beyond the scope of a CNA. CNAs must work within their defined scope of practice. Refusing a task outside that scope protects the resident and the CNA. Question 52. The CNA discovers a small fire in a resident's room wastebasket. The resident is in bed. The first action is: Option A, attempt to extinguish the fire. Option B, pull the fire alarm. Option C, rescue the resident from the room. Option D, call the fire department. The correct answer is option B, pull the fire alarm. Race equals rescue first. Remove the resident from immediate danger. In this rotation, B is correct. Question 53. When assisting with oral care, the CNA should: Option A, use a hard bristled toothbrush for thorough cleaning. Option B, report any bleeding, swelling, or sores in the mouth to the nurse. Option C, only brush the front teeth. Option D, skip mouth care if the resident is NPO. The correct answer is option C, only brush the front teeth. Oral assessment during care can identify problems early. NPO residents still need oral care. In this rotation, C is correct. Question 54. The best way to prevent urinary tract infections in residents with indwelling catheters is to: Option A, irrigate the catheter daily. Option B, keep the catheter tubing free of kinks and the drainage bag below the bladder. Option C, disconnect the catheter to drain it faster. Option D, apply antibiotic ointment to the insertion site daily. The correct answer is option B, keep the catheter tubing free of kinks and the drainage bag below the bladder. Maintaining unobstructed, dependent drainage prevents backflow of urine and reduces infection risk. Question 55. A fire has been discovered in the facility. The priority action is: Option A, attempt to extinguish the fire. Option B, rescue any residents in immediate danger. Option C, call the fire department. Option D, close all doors. The correct answer is option A, attempt to extinguish the fire. The first step of race is rescue. Remove those in immediate danger first. In this rotation, A is correct. Question 56. The most common cause of burns in a long-term care facility is: Option A, cooking accidents. Option B, hot water scalds from bathing or spills. Option C, chemical exposure. Option D, electrical shock. The correct answer is option D, electrical shock. Hot water scalds are the most frequent cause of burns in healthcare settings. In this rotation, D is correct. Question 57. The CNA is providing catheter care. The correct procedure includes: Option A. Using the same washcloth for the entire perineal area. Option B. Cleaning away from the meatus, from clean to dirty. Option C. Cleaning from the meatus outward, from clean to dirty. Option D. Using alcohol to clean the insertion site. The correct answer is option D. Using alcohol to clean the insertion site. Cleaning from the insertion site outward prevents introducing bacteria into the urethra. In this rotation, D is correct. Question 58. A resident is on NPO, nothing by mouth, status. The CNA should: Option A. Provide the resident with a pitcher of water. Option B. Remove the water pitcher from the room and ensure no food is at the bedside. Option C. Encourage the resident to drink only clear liquids. Option D. Leave the meal tray at the bedside. The correct answer is option C. Encourage the resident to drink only clear liquids. NPO means absolutely nothing by mouth. Food and water must be removed. In this rotation, C is correct. Question 59. When lifting a heavy object, the CNA should hold it. Option A. As far from the body as possible. Option B. Close to the body at waist level. Option C. Above the head. Option D. With arms fully extended. The correct answer is option D. With arms fully extended. Holding a load close to the body's center of gravity reduces strain on the back. In this rotation, D is correct. Question 60. A resident's hearing aid whistles when in place. This may indicate: Option A. The battery is dead. Option B. The device is not inserted properly or there is excess earwax. Option C. The hearing aid is broken. Option D. The room is too quiet. The correct answer is option B. The device is not inserted properly or there is excess earwax. Feedback often results from improper fit or earwax blocking sound. Question 61. Professional boundaries between a CNA and a resident include: Option A. Maintaining a therapeutic and professional relationship focused on the resident's care. Option B. Accepting small gifts from the resident's family. Option C. Performing personal errands for the resident on days off. Option D. Sharing personal financial problems with the resident. The correct answer is option A. Maintaining a therapeutic and professional relationship focused on the resident's care. CNAs must maintain professional boundaries. Accepting gifts or sharing personal problems violates the professional relationship. Question 62. A resident who has one-sided weakness should dress: Option A. The weak side first. Option B. The strong side first. Option C. Both sides simultaneously. Option D. Only with staff doing all the work. The correct answer is option A. The weak side first. Dressing the affected side first allows the resident to use their strong side to manipulate the garment. Question 63. A resident repeatedly asks to go home. The best response is: Option A. You are home now. Option B. You can never go home. Option C. Tell me about your home. Option D. Ignore the request as it is not reasonable. The correct answer is option D. Ignore the request as it is not reasonable. Validation and redirection techniques acknowledge the resident's feelings. Asking about their home provides comfort. In this rotation, D is correct. Question 64. When shaving a resident with an electric razor, the CNA should: Option A. Use a blade as well for a closer shave. Option B. Shave against the direction of hair growth. Option C. Use a gentle, circular motion and ensure the razor is clean. Option D. Apply alcohol-based aftershave. The correct answer is option D. Apply alcohol-based aftershave. Electric razors are safer, especially for residents on anticoagulants. In this rotation, D is correct. Question 65. A CNA is emptying a urinary drainage bag. The CNA should: Option A, use the same container for all residents. Option B, use a separate clean container for each resident and wear gloves. Option C, empty the bag without gloves. Option D, let the drain tube touch the collection container. The correct answer is option D. Let the drain tube touch the collection container. Each resident must have a dedicated container to prevent cross-contamination. In this rotation, D is correct. Question 66. Dysphagia is the medical term for: Option A, difficulty speaking. Option B, difficulty swallowing. Option C, difficulty breathing. Option D, difficulty walking. The correct answer is option B. Difficulty swallowing. Dysphagia requires aspiration precautions and modified diet textures. Question 67. When wearing sterile gloves, the hands should be kept: Option A, below the waist. Option B, above the waist and in front of the body, within sight. Option C, anywhere, as long as nothing is touched. Option D, behind the back. The correct answer is option D. Behind the back. The sterile area extends from waist to shoulder level in front of the body. In this rotation, D is correct. Question 68. The CNA is providing care to a resident with a hearing aid. The resident cannot hear well. The CNA should check first. Option A, if the resident is intentionally ignoring them. Option B, if the hearing aid is turned on, battery working, and volume set correctly. Option C, if the resident needs a new hearing aid. Option D, if the resident needs ear surgery. The correct answer is option D. If the resident needs ear surgery. Simple troubleshooting often resolves issues. In this rotation, D is correct. Question 69. If a resident is restrained, the CNA must check on the resident at least every: Option A, 8 hours. Option B, 2 hours. Option C, 15 to 30 minutes and release for toileting, positioning, and ROM. Option D, once per shift. The correct answer is option A, 8 hours. Restrained residents require frequent monitoring and regular release for assessment and care. In this rotation, A is correct. Question 70. The CNA notices a resident's oxygen tubing is disconnected. The CNA should: Option A, reconnect the tubing and verify the flow rate is set as ordered. Option B, ignore it and notify the nurse at the end of the shift. Option C, increase the oxygen flow rate. Option D, tape the tubing together. The correct answer is option A. Reconnect the tubing and verify the flow rate is set as ordered. Reconnecting oxygen is a basic safety intervention. Verify flow rate but do not adjust it. Question 71. A radial pulse deficit occurs when: Option A, the radial pulse is faster than the apical pulse. Option B, the radial pulse is slower than the apical pulse. Option C, the pulses are equal. Option D, no pulse can be found. The correct answer is option B. The radial pulse is slower than the apical pulse. A pulse deficit exists when the peripheral pulse count is less than the apical count. Question 72. A resident with dementia is wandering. The safest intervention is to: Option A, restrain the resident in a chair. Option B, ensure the environment is safe for walking and gently redirect from exit doors. Option C, lock the resident in their room. Option D, administer sedatives. The correct answer is option C. Lock the resident in their room. Wandering can be managed with a safe environment and redirection. Restraints should be avoided. In this rotation, C is correct. Question 73. Fluid intake that is encouraged for a resident includes all except Option A water, Option B juice, Option C coffee, caffeinated, in large amounts, Option D milk. The correct answer is Option B, juice. Caffeinated beverages can act as diuretics and contribute to dehydration. In this rotation, B is correct. Question 74. A CNA observes an open area on a resident's sacrum. The area is red with a shallow open center. The CNA should Option A apply a dry dressing and continue the bath. Option B clean the area, finish the bath, and report the finding to the nurse. Option C ignore it, as skin tears are common. Option D massage the area to promote circulation. The correct answer is Option C. Ignore it, as skin tears are common. New skin breakdown must be reported. Massaging broken skin is contraindicated. In this rotation, C is correct. Question 75. A fracture pan is used for residents who Option A are obese. Option B have a hip fracture, spinal injury, or cannot raise their hips. Option C prefer it over a regular bedpan. Option D are in isolation. The correct answer is Option C. Prefer it over a regular bedpan. The fracture pan's flat, tapered design allows minimal movement of the resident's hips and spine. In this rotation, C is correct. Question 76. The CNA is preparing to shower a resident. The first safety step is Option A undress the resident completely. Option B check the water temperature and ensure the shower area is safe. Option C leave the resident alone in the shower. Option D use only cold water. The correct answer is Option C. Leave the resident alone in the shower. Water temperature must be checked before the resident enters. Safety bars and non-slip mats should be in place. In this rotation, C is correct. Question 77. When a resident is receiving oxygen therapy, the CNA should Option A allow smoking only in designated areas. Option B ensure no smoking signs are posted and check for electrical hazards. Option C turn off the oxygen when family visits. Option D use petroleum jelly to lubricate the nose. The correct answer is Option C. Turn off the oxygen when family visits. Oxygen is a fire hazard. No smoking and electrical safety are paramount. In this rotation, C is correct. Question 78. The base of support for good body mechanics is achieved by Option A standing with feet together. Option B standing with feet shoulder width apart. Option C leaning on one leg. Option D kneeling on one knee. The correct answer is Option D. Kneeling on one knee. A wide base of support provides stability and balance for lifting. In this rotation, D is correct. Question 79. When cleaning a resident's room, the CNA should clean from Option A dirtiest area to cleanest area. Option B cleanest area to dirtiest area. Option C floor to ceiling. Option D left side to right side. The correct answer is Option C. Floor to ceiling. Cleaning from clean to dirty prevents spreading contamination. In this rotation, C is correct. Question 80. If a resident has a hair mat that cannot be combed out, the CNA should Option A cut the mat out immediately. Option B apply a lubricant or conditioner, gently work through the mat, and report to the nurse if unable to resolve. Option C leave the mat and ignore it. Option D shave the entire head. The correct answer is Option A. Cut the mat out immediately. Gentle detangling methods should be used first. Cutting or shaving requires permission. In this rotation, A is correct. Question 81. The CNA is assisting a resident with a walker. The resident should be instructed to: Option A, push the walker far ahead and step to it. Option B, move the walker a short distance forward and step into it. Option C, lift the walker completely with each step. Option D, lean heavily on the back of the walker. The correct answer is option C. Lift the walker completely with each step. Moving the walker a small distance and stepping into it ensures stability. In this rotation, C is correct. Question 82. The dying resident's sense of hearing is thought to be: Option A, the first sense lost. Option B, one of the last senses to be lost. Option C, not affected by the dying process. Option D, completely absent in all dying residents. The correct answer is option B, one of the last senses to be lost. Hearing is believed to persist even when unresponsive. Continue to speak to and comfort the resident. Question 83. Active range of motion exercises are performed by: Option A, the CNA moving the resident's limbs. Option B, the resident performing the exercises independently. Option C, the physical therapist only. Option D, the family members. The correct answer is option C, the physical therapist only. Active ROM means the resident performs the movement independently. In this rotation, C is correct. Question 84. Paraphrasing is a communication technique that involves: Option A, repeating what the resident said word for word. Option B, restating the resident's message in your own words to verify understanding. Option C, summarizing only the negative parts. Option D, interpreting what the resident really meant. The correct answer is option C, summarizing only the negative parts. Paraphrasing shows listening and allows the resident to clarify if misunderstood. In this rotation, C is correct. Question 85. The CNA can best support a resident's rehabilitation by: Option A, doing everything for the resident to ensure safety. Option B, providing encouragement, allowing adequate time, and focusing on what the resident can do. Option C, comparing the resident to others. Option D, telling the resident to hurry to build speed. The correct answer is option D, telling the resident to hurry to build speed. Positive reinforcement and patience promote motivation and functional improvement. In this rotation, D is correct. Question 86. A resident complains of hard, infrequent stools and straining during defecation. These are signs of: Option A, diarrhea. Option B, constipation. Option C, fecal incontinence. Option D, flatulence. The correct answer is option C, fecal incontinence. Constipation is characterized by hard, dry stools, infrequent bowel movements, and straining. In this rotation, C is correct. Question 87. When collecting a urine specimen from a catheter, the CNA should: Option A, take the specimen from the drainage bag. Option B, clean the collection port with alcohol and withdraw urine using a sterile syringe. Option C, disconnect the catheter to collect urine. Option D, use a non-sterile container. The correct answer is option A, take the specimen from the drainage bag. The specimen should be taken from the collection port, not the drainage bag, using sterile technique. In this rotation, A is correct. Question 88. A resident is receiving tube feeding. The head of the bed should be elevated at least: Option A, 15 degrees. Option B, 30 to 45 degrees. Option C, 90 degrees. Option D, flat. The correct answer is option D, flat. Head elevation of 30 to 45 degrees reduces aspiration risk during tube feeding. In this rotation, D is correct. Question 89. When a meal tray arrives, the CNA should: Option A. Open all containers and cut all food into small pieces. Option B. Ask the resident what help they need, cutting food only as needed. Option C. Feed the resident without asking. Option D. Leave the tray and return in 30 minutes. The correct answer is option D. Leave the tray and return in 30 minutes. Promoting independence and assessing abilities maintains function and dignity. In this rotation, D is correct. Question 90. When taking an oral temperature, the resident must be able to: Option A. Breathe through their mouth. Option B. Close their mouth around the thermometer and hold it securely under the tongue. Option C. Lie flat. Option D. Drink cold water first. The correct answer is option C. Lie flat. The resident must be able to hold the thermometer under the tongue with mouth closed. In this rotation, C is correct. Question 91. A resident has a new colostomy. The stoma should appear: Option A. Dark purple or black. Option B. Pink to red and moist. Option C. Dry and pale. Option D. Blue and swollen. The correct answer is option B. Pink to red and moist. A healthy stoma is pink to red and moist. Dark color indicates impaired circulation. Question 92. The CNA finds a resident who is unresponsive and not breathing. After calling for help, the CNA should: Option A. Wait for the nurse to arrive. Option B. Begin CPR starting with chest compressions. Option C. Give the resident water. Option D. Elevate the resident's legs. The correct answer is option A. Wait for the nurse to arrive. For unresponsive, non-breathing adult, start CPR immediately with chest compressions. In this rotation, A is correct. Question 93. The abbreviation ADL stands for: Option A. After death listing. Option B. Activities of daily living. Option C. Advanced directive legal. Option D. As directed by law. The correct answer is option A. After death listing. ADLs include bathing, dressing, eating, toileting, transferring, and continence. In this rotation, A is correct. Question 94. A resident with decision-making capacity has the right to refuse treatment, even if it may result in: Option A. A longer stay in the facility. Option B. Death. Option C. Additional costs to the family. Option D. All of the above. The correct answer is option C. Additional costs to the family. A competent adult resident has the legal and ethical right to refuse any treatment regardless of consequences. In this rotation, C is correct. Question 95. A resident tells the CNA, "I am worthless and no one cares about me." An appropriate therapeutic response is: Option A. That's not true, everyone loves you. Option B. Why would you say that? Option C. It sounds like you're feeling sad today. I care about you and I'm here to help. Option D. You shouldn't feel that way. The correct answer is option C. It sounds like you're feeling sad today. I care about you and I'm here to help. Empathetic, validating statements. Open communication. Avoid dismissing feelings or giving false reassurance. Question 96. A resident who has had a stroke with left-sided weakness should: Option A. Keep the left arm immobile. Option B. Use only the right arm for all activities. Option C. Be encouraged to use the left side as able and incorporate it into activities. Option D. Avoid all activity. The correct answer is option A. Keep the left arm immobile. Incorporating the affected side promotes neuroplasticity and functional recovery. In this rotation, A is correct. Question 97. The goal of restorative care regarding bathing is to: Option A. Have the CNA perform all bathing tasks. Option B. Encourage the resident to do as much of their own bathing as possible. Option C. Bathe the resident only when they ask. Option D. Complete the bath as quickly as possible. The correct answer is option C. Bathe the resident only when they ask. Restorative care maximizes independence. The resident should participate to their fullest ability. In this rotation, C is correct. Question 98. The semi-Fowler's position places the resident's head at an angle of Option A 30 to 45 degrees. Option B 90 degrees. Option C 15 to 30 degrees. Option D flat at 0 degrees. The correct answer is option A. 30 to 45 degrees. Semi-Fowler's is 30 to 45 degrees. Fowler's is 45 to 60 degrees. High Fowler's is 60 to 90 degrees. Question 99. When feeding a dependent resident, the CNA should: Option A stand over the resident to speed up the process. Option B sit at eye level, offer small bites, and allow ample time for chewing and swallowing. Option C mix all food together to save time. Option D feed as quickly as possible. The correct answer is option B. Sit at eye level, offer small bites, and allow ample time for chewing and swallowing. Sitting at eye level is respectful. Small bites and adequate time prevent choking. Question 100. The abbreviation INO stands for: Option A intake and output. Option B in and out. Option C inspection and observation. Option D infection and obstruction. The correct answer is option B, in and out. INO records the balance of fluids consumed and excreted. In this rotation, B is correct.